During the process of our child letting my wife and I know that he was trans, as parents we had many feelings. So one of those feelings was joy, because we knew that he would be able to flourish and thrive in a way that he wouldn't have been able to had he not come out as trans. But one of those emotions was also fear. And we knew that most of the community would be amazing and supportive, and the massive attendance by folks against this absolutely garbage bill, I think, is evidence of that here today. And I'm so grateful for everybody who has and will speak against this. But we also knew that a small, angry, vile pocket of our community hates trans folks and hates trans kids. And we were right on both counts. Our son went on to thrive and is an amazing, full, realized person, working to care for older adults, perhaps not coincidentally in Minnesota, where rather than trying to pass legislation that would demonize and target him, they just passed a trans sanctuary bill. So to the many folks across the aisle who say that nobody wants to work anymore, perhaps it's that nobody wants to work in a state that doesn't want them to exist. But we were also right about the people in our community who want our child and thousands more not to exist, and this legislation underlines that. This legislation, merely by its introduction, does damage. It causes harm. Every speech I've ever uttered in this building has been packed full of data, and the data is on our side on this, and you have heard it, and you will hear more of it yet today. But having parented an amazing trans child, the piece of data that matters the most to me and other parents is this: that according to the Trevor Project's 2023 survey, that half of trans and non-binary kids seriously considered suicide in the last year, and that 1 in 5 attempted it. And because my colleague from the 97th seemed unable to find anything relating the effectiveness of gender-affirming care and suicide, I'll point him and many others to a meta-study literally called Suicide-Related Outcomes Following Gender-Affirming Treatment, a review, and it concluded that of the 23 studies that met the criteria, the majority indicated a reduction in suicidality following gender-affirming treatment. It's on the National Institute of Health website. If you type in suicide and transgender in a secret website called Google, it's the first thing to come up. This is not tough to find. So the idea that the science is not settled on this is frankly bullshit. I'll get back on track. I want to be clear, trans kids aren't considering or attempting suicide because of who they are, but because of who we are in this building right now. The authors of this garbage are responsible for trans suicides, for trans attempted suicides. It isn't the kids and their identities. It's a society in which actual adults sit down in a room and put pen to paper to try to codify their hatred, to try to mask their intolerance as concern, and to cover their ignorance with a thin veneer of junk science. I would call the authors ghouls and empty husks of people, but I won't, because the authors of this legislation are not in this building today. They're across the U.S. They're not evil, the folks who have their names on this legislation. They are, at best, plagiarists. So I'm asking you, just drop the act. Speak plainly. Stop copying and pasting this legislation and the talking points from other states and tell it like it is. You are so challenged by the mere existence of trans kids that your own fragile sense of self is threatened. Tell us that rather than grappling with your own insecurities, you'd rather shut kids up and push them back into the corners. Tell us that kids don't deserve to be listened to because you're deeply and personally afraid of what they're saying. Gender-affirming care saves lives. This legislation endangers them. The cowards with their names on it endanger our children. You should be ashamed. Very happy to yield to questions or responses.
Just under the wire, Representative.